As COVID-19 continues to exist, we must maintain all efforts to minimize the risk of spreading. As we know, COVID-19 affects all people differently. Many of the people we support have existing health conditions or disabilities which may put them at a higher risk of contracting the virus. It also may decrease their ability to fight the virus, which can increase the chance of a negative outcome such as death. This mini lesson will provide you instruction on our policy for decreasing the spread of COVID-19. DNS maintains requirements regarding the use of masks, recording temperatures, reporting any signs or symptoms of COVID, and procedures for quarantine. This addendum lesson to the PPE courses outlines these rules and policy expectations. One of the most effective ways to prevent the spread of COVID-19 is to be aware and recognize the symptoms and act immediately to quarantine yourself. Symptoms of COVID-19 include, but not limited to, the following: fever, cough, shortness of breath or difficulty breathing or chills, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. Close contact is defined as being within approximately 6 feet of a person with COVID-19, such as caring for or visiting the COVID-positive person, or sitting within 6 feet of them for 15 minutes or longer. Having unprotected direct contact with infectious secretions or excretions of the person, e.g., being coughed on, touching used tissues with a bare hand, urine, feces. Indirect contact is greater than 6 feet from affected individual and less than 15-minute exposure with an affected person. You must complete the worksite attestation before you enter your worksite. Before you enter a home or worksite, you must have a mask on and complete the attestation outside the entrance or immediately upon walking in the door. Homes and offices must have attestation forms, a working thermometer, sanitizer, ink pens and wipes to clean hands and pens upon using. The Employee COVID-19 Daily Symptom Attestation Form serves as proof that the information you provide is true and factual. The attestation form is to be completed daily, before entering your worksite. Each employee must accurately answer the questions pertaining to COVID-19 symptoms. Your response to the questions, listed on the previous slide, indicates your agreement with the following. You acknowledge that the information you are providing is true and accurate to the best of your knowledge. You also understand that providing false or misleading information on this form will result in disciplinary action, up to and including termination. You agree to report to your supervisor any future symptoms, diagnosis, or high-risk conditions. You agree that if such symptoms or conditions develop, you will immediately inform your supervisor. If your temperature registers 99.9 or above or you answered yes to any of the questions on the attestation, you must call your supervisor and leave immediately. Do not go into the home or worksite. There may be similar COVID-19 symptoms which are due to a known medical condition, such as allergies, regular stomach issues, asthma, smoking, etc. If you are confident the symptom is due to a known medical condition, you may mark the symptom no. However, if you're not feeling well regardless of the cause, please stay home. If you attest to even one of the signs and symptoms of COVID-19 listed on the attestation form, you absolutely cannot work and you must inform your supervisor and employee relations immediately. All employees must use the appropriate mask at all times when working with individuals supported. Employees working in offices must wear masks as well, unless they are in a private office behind closed doors. The next slide provides a guide and alternative practices when the need arises. Personal protective equipment, PPE, including surgical and N95 masks, will be supplied by DNS. Surgical masks are required in all care settings or any setting where an employee interacts with an individual supported. N95 masks are required when working with an individual who is COVID-19 positive. Personal cloth masks or surgical masks may be worn in all other work settings such as an office. Cloth masks are not considered PPE by the CDC but are recommended by current guidance to help prevent the spread of illness. Please review the guide for best practices and alternate methods for the use of personal protective equipment. The scenarios will help guide you to ensure you are implementing safe and effective practices for preventing the spread of COVID-19. We are also responsible for monitoring and reporting COVID signs and symptoms of those we support. Temperature checks are required 3 times a day. Pulse oximeter checks are also to be completed 3 times a day. If the temperature reads 99.9 degrees or above, you must report it to the area nurse. If the pulse oximeter reads 95 or below, you must also contact the nurse. On a continuously basis, staff must observe for any signs or symptoms of COVID. Many people we support may not be able to express their symptoms with words, therefore, it is critical that we observe, monitor and pay attention to any signs or symptoms or unusual behavior that might indicate an illness. When in doubt, always report anything unusual to your area nurse. Proper cleaning is a top priority for stopping the spread of any virus or germ. Each staff has the responsibility to clean. Do not assume someone else is going to do it and it is not your responsibility, because it is. Each shift and each staff on that shift is responsible to perform cleaning in a safe and effective manner. This includes vehicles as well. When cleaning, follow the 6 steps for safe and effective disinfectant use. Step 1. Check that your product is EPA approved. Step 2. Read the directions on the disinfectant bottle or container. Step 3. Pre-clean the surface. Step 4. Follow the contact time which is found in the directions for use. Step 5. Wear gloves and wash your hands after removing them. Step 6. Lock or secure the disinfectants in a safe area. What surfaces should you clean? If you sprayed a mist in the air, where would it land? Think of COVID as that mist. Whatever that mist falls on is what you clean. This includes flat surfaces, countertops, tabletops, handheld devices, such as remotes, phones, gaming devices. Clean doorknobs, light switches, bathroom receptacles, sinks, toilets, inside and out, appliances, handles, etc. By taking basic precautions, we can help keep each other, the individuals we support, and our families safe. Thank you for your commitment and for helping to stop the spread.